Hello everyone, Dr. Charlie Johnson, physical therapist. Yet another self-test to determine if your frozen shoulder is truly frozen shoulder. I have here, looks like a flower, but stings like a bee. Okay, you may know that was like an old YouTube, I think, craze that went around. But it absolutely makes no sense. Okay, that's what's funny about it. And what I mean by it is that frozen shoulder might look and smell like a flower to other physicians, other physical therapists, whoever you may be seeing, and perhaps you've been diagnosed with frozen shoulder, but it's either just not going away, although it might take some time for it to go away, or something's kind of goofy about it, okay? And you've been treated and treated and treated, and nothing's changing. Well, there's a possibility that frozen shoulder that looks like frozen shoulder really isn't frozen shoulder. Now, it stings like a bee because maybe your frozen shoulder doesn't just feel kind of dull and achy. Maybe it feels kind of burny or stingy. It still could feel dull and achy, okay? But again, just another avenue for you to explore and determine whether or not your frozen shoulder is actually due to a hot and bothered nerve in your neck and kind of upper arm rather than an actual frozen shoulder. Pretty cool. So again, welcome to the arm tension test. We're going to do it with a twist, and I'm going to show you two different twists and kind of two self-movement tests to determine if your frozen shoulder, or heck, if your shoulder pain is actually coming from the shoulder per se. Okay, so the first test would be the arm tension test again, but we're going to twist it. So this time, let's say her right arm is the one with frozen shoulder or shoulder pain. You'll do it on the pain-free side. Okay, so palm up, head in neutral, raise it up as far as you can go. Perfect, good, and down. No problemo, perfect, no issues, okay? Now she's going to do the same thing, palm up on her painful side, and zap, she gets it right there. It's very sharp pain, stops you in your tracks, all right? Down, okay? Now, what she's going to do, we saw where she got with her head neutral, she's going to tilt the head towards, okay? Now she's going to reach up, and look at that. So she gets quite a bit improvement. It has to be noticeable improvement for this arm tension test to be positive, okay? Now she's going to tilt her head away. She's going to do the same thing. Raise it up. Okay. And she doesn't get as much motion. So she loses motion in her shoulder just by moving her neck. It's not really a problem in the shoulder. It's likely a problem with something it connects it to, which in this case is really only the nerves in the neck, okay? So if you do this test and you get much improved motion in the shoulder by tilting the head towards and reduced function in the shoulder by tilting the head away, there's a good chance, being that we only changed the neck and we didn't change anything in the shoulder, that a hot and bothered nerve is causing your arm pain. Okay, but perhaps your biggest complaint is that, not that you can't reach up and overhead, but that you have difficulty reaching behind your back. Here's the second arm tension test with a twist. Again, stand anywhere, do this anywhere you'd like. What I want you to do is do it on the pain-free side first so you get an idea. So on our pain-free side, excellent motion. Okay, down, no problem. Okay, on her painful side, she's going to reach up. Again, this is painful for you, so I understand. Just pick a baseline. Maybe say, okay, I feel as though I can get to the bottom of my belt. Got it. Keep that in, make a mental note. Down. Her head was in neutral. Now, I think you're seeing the trend. Okay, reach up behind the back again. Much better motion, right? We didn't change anything in the shoulder. All we did was slacken the nerves in the neck. Bring it back down. Perfect. Now, pre-tension, tilt the nerves away. Bring it up again. Even less than when the head was in neutral. Why? Because we tensioned the nerves in the neck. Okay. So what these tests do is that they challenge the nervous system rather than the shoulder itself. So if the tests are positive, just like you saw, then likely you do not have a frozen shoulder. Okay, frozen shoulder, although it looks and smells like it, is not really your frozen shoulder. It could be coming from a hot and bothered nerve somewhere between your neck and your arm. Now these things can be a bit of a pain in the butt to treat, okay, because nerves, when they become irritated, are hot and bothered, so they take some time to chill out. But you're much better off finding a physical therapist who understands this and is able to catch it and diagnose it, because I see it far too often. So again, find yourself an excellent physical therapist who understands nerves.